I'm Madeline, and I'm going to be demonstrating an IV push medication. So right here we have our MAR, and I'm just going to be looking for the right patient, right medication, right dose, right route, and right time for the medication rights. Before we start, I'm going to put on some hand hygiene, and then I'm going to put on my gloves.
You're going to prepare your medication, then check the IV side. Right?
Okay.
Yeah.
And before I start, I'm just going to be making sure that I have the right patient, and I'm going to be checking the name and date of birth and verifying it with the MAR. And I also want to make sure any allergies that I may be aware, so I would ask him if he has any allergies and verify it with the MAR. And once we're good to go, we'll start on with the medication. So the order says we're going to administer Lasix 20 milligram push, IV push, and the vial comes in a 40 milligram 4 ml. And with that being said, we're going to be giving 2 mLs. So before I inject the vial, I'm going to be cleaning the site for 10 seconds to make sure it's clean and no bacteria gets in there. And then I'm going to be getting the vial, and I'm going to pull back two, and then I'm going to be pushing the air in there.
So we're going to go ahead and prepare our medication. We have our 2 to 3 ml of saline wash, and we will just need our 2 ml of medication, which is Lasix. So we're going to clean the cap of it for 10 seconds.
Just put it in bold behind the thing.
And then we're going to draw air for 2 ml.
Okay, so right there we have 2 mLs. You can see. Okay. So I have that pulled up, and then I'm going to look for the patency of my IV site. I'm just going to make sure there's no infiltration or infection at the site, make sure it's okay to administer. I'm going to be doing a saline flush about 1 to 2 mLs. So I'm going to be doing that. And I just want to make sure I clean the site so there's no infection. So I'm going to do that for about 10 seconds. And then I'm going to administer this. Do that slowly. So do like 1.
And then after that, just making sure that our IV site is free of infection, phlebitis, or K. We have our 3 ml of saline.
And then I'm going to clean the site again with a new clean alcohol for 10 seconds.
And just make sure we unclamp.
Oh, I was supposed to unclamp it.
Make sure there's no bubbles.
I'm just gonna, so before I would do it, I would unclamp it before I do the saline and the medication. I wanted to say that. Okay, so then I'm going to be administering the Lasix, and with this I administer Lasix very slowly, so over 1 to 2 minutes.
So saline, technically we're pushing 1 ml per minute, so since we are administering 2 ml,
So be really slow.
push it for 2 ml.
So be like 1 to 2 minutes, and
But since we are doing this for video, I'm just going to push it. After we are done with that,
and
use a new
then
wipe and clean again for 10 seconds.
oh, the mannequin is a little okay, so after that I'm going to be cleaning for 10 seconds again, and then I'm going to be administering saline for
That was our last thing.
1 to 2
Clean again for 10 seconds.
mLs.
We will use a new cap.
And then I will
To put this back
administer
on?
her crown of same.
Okay. And then I'm going to be cleaning again for 10 seconds
We're gonna lock
with the new alcohol.
cap. Lock.
It will go through.
It's locked, and then we're just gonna make sure assess our patient.
Okay, and then I'm going to put on a new cap,
Take our gloves
and
off,
then I'm going to clamp.
make sure to document everything we did.
And once I did that, I'm just going to make sure that there was no reaction and that there's patency and everything looks okay, no infection. And then I'm going to document the right procedure and what the medication I gave. And then I'm going to take my gloves off and do hand hygiene.